Bismillahir Rahmanir Rahim. Assalamu alaikum. Don't take my words ill. If you are not wearing your PPEs, if you are not following effective SOPs to prevent infections, then you are contributing in the transmission of infections. Today, I will be discussing with you the end result of your negligence and not wearing PPEs and not following the SOPs of infection prevention and control measures. Hospital acquired infections. Guys, these are the infections which are harbored by the patient 48 hours after admission into the hospital or after discharge from the hospital. It means that these infections are not present at the time of admission of the patient in the healthcare establishment. Rather, patient harbors these infections 48 hours after admission or when the patient has been discharged 48 hours after discharge from the patient. What are common hospital acquired infections? Most common in our setup, urinary tract infections. These are because of passage of Foley's catheter in almost 80% of indoor patients. Urinary tract infections. Number two, SSI, surgical site infections. These are the infections which are produced, which are developed by the patient as a result of infections at the surgical site. Again, I repeat, at least 7 days, at least 1 month after the operation, if the patient develops infection at the operation site at least 30 days or 1 month. Number third, CVP line, central line infections. These are mostly seen in dialysis patients, in patients in which central line is passed. Number four, bloodstream infections. Bloodstream infections. Number five, we have got ventilator acquired pneumonias. Ventilator acquired pneumonias. All those patients which are put on mechanical ventilation or assisted ventilation, if they develop infection, then they are categorized to be having ventilator acquired pneumonias. And number last, gastroenteritis. These are mostly harbored by the patient when he takes food from hospital canteens and his personal eatables are infected in the hospital environment. Now, student guys, we have got these 6 common hospital acquired infections. I repeat, Foley's catheter induced urinary tract infections, surgical site infections. Number third, central line infections, bloodstream infections, ventilator acquired pneumonias, and gastroenteritis. Now, very briefly, how to avoid these hospital acquired infections. Very brief, we have to follow the universal precautionary measures. What are those universal precautionary measures? Number one, most important, hand hygiene. We have got hand hygiene. Number two, PPEs. Wearing of PPEs, hand hygiene, these are mandatory to prevent hospital acquired infections. Then we have got environmental cleaning. Environmental cleaning, I have many times informed you the use of domestic bleach as a disinfectant. We have to disinfect the environment of patient as well as all those items with which patient comes in contact. Next, number four, we have got immunization. Immunization, timely immunization of patients as well as working staff. Now, students, what are the common microorganisms which are responsible for these hospital acquired infections? Among the viruses, we have got most important, most common hepatitis B infections, hepatitis C viral infections. Among bacterial, we have got Staph aureus infections, pneumococcal infections, and among fungal infections, we have got most important candida infections. So it was very brief about hospital acquired infections, and today's take home message is at every cost, each and every healthcare professional must follow infection prevention control measures, the universal precautions, that is use of PPEs, hand washing, and environmental cleaning. Only these practices can save us and other patients from hospital acquired infections. Very, very thankful for your precious time. Thank you. Allah Hafiz.